Hi guys, Louie here with a non-precious metals related topic. As I mentioned in my last video, I've got some information on face masks and an unboxing of an N95 respirator to show you guys, but this is the article that you'll want to reference if you're in the market for a face mask, and no matter what face mask you use or wear, they won't do you much good unless you use them properly, change them frequently, and dispose of them properly. All right, so keep that in mind. You do have to stay compliant with the safety practices. But let's go ahead and get to this article about the difference between surgical masks and N95 respirators. And this is a very legit article. One second. Okay, published September 3rd, 2019. This is a scientific study about the differences between surgical masks and N95 respirators. And the title of this, Surgical Masks as Good as Respirators for Flu and Respiratory Virus Protection. Okay, and neither one is all that good, but if you are going to seek this kind of protection, here is an article that you'll want to be aware of before you buy masks. Dallas, September 3rd, 2019. Researchers may finally have an answer in the long-running controversy over whether the common surgical mask is as effective as more expensive respirator-type masks in protecting healthcare workers from flu and other respiratory viruses. Okay, the study was in a healthcare setting. The study published today in JAMA compared the ubiquitous surgical or medical mask, which costs about a dime, to a less commonly used respirator called an N95, which costs around $1. The study reported no significant difference in the effectiveness of medical masks versus N95 respirators for prevention of influenza or other viral respiratory illnesses. This study showed there is no difference in incident of viral respiratory transmission among healthcare workers wearing the two types of protection. Dr. Trish Pearl, chief of UT Southwestern's Division of Infectious Disease and Geographic Medicine, and the report's senior author. This finding is more from a public policy standpoint because it informs about what should be recommended and what kind of protective apparel should be kept available for outbreaks. Medical personnel, in particular nurses, doctors, and other with direct patient contact, are at risk when treating patients with contagious diseases such as influenza. A large study conducted in a New York hospital system after the 2009 outbreak of H1N1 or swine flu found almost 30% of healthcare workers in emergency departments contracted the disease themselves, Dr. Pearl said. During the pandemic, the U.S. Center for Disease Control, CDC, recommended using the tighter-fitting N95 respirators designed to fit closely over the nose and mouth and filter at least 95% of airborne particles, rather than the looser-fitting surgical masks routinely worn by healthcare workers, Dr. Pearl said. But some facilities had trouble replenishing the N95s as supplies were used. In addition, there are concerns healthcare workers might be less vigilant about wearing the N95 respirators, since many perceive them to be less comfortable than medical masks, such as making it harder to breathe and being warmer on the wearer's face. Earlier clinical studies comparing the masks and respirators yielded mixed results, said Dr. Pearl, also a professor of internal medicine who holds the J.P. Sanford Professorship in Infectious Diseases. The new study was performed at multiple medical settings in 7 cities around the country, including Houston, Denver, Washington, New York, by researchers at the University of Texas, the CDC, Johns Hopkins University, and University of Colorado, Children's Hospital Colorado, the University of Massachusetts and University of Florida, and several Department of Veterans Affairs hospitals. Researchers collected data during four flu seasons between 2011 and 2015, examining the incidence of flu and acute respiratory illness in and amongst 2,400 healthcare workers who completed the study. The project was funded by the CDC. and it was a huge and important study, the largest ever done on the issue. In the end, 207 laboratory-confirmed influenza infections occurred in the N95 group versus 193 among medical mask wearers. According to the report, in addition, there were 2,734 cases of influenza-like symptoms, laboratory-confirmed respiratory illnesses, and acute or laboratory-detected respiratory infections, where the workers may not have felt ill. In the N95 group compared with 3,039 such events among the medical mask wearers. The takeaway is that this study shows one type of protective equipment is not superior to the other, she said. Facilities have several options to provide protection for their staff, which include surgical masks, and can feel that staff are protected from seasonal influenza. Our study supports that in the outpatient setting, there was no difference between the tested protections. They expect to do more tests in the future, and here is a picture of Dr. Pearl. So that is an important study. I'll just give a little bit of commentary about this. So as I said, it's not so much the mask that you wear, according to this study. It is how you practice wearing it. And actually, another study, which I'm not going to go into here, noted that the primary benefit of these masks is in hand-to-mouth infection control. So most of us touch our face and eyes, even ears, quite a few times a day, and a mask like this can prevent the inadvertent transmission of the virus from your hands to your mouth. Of course, it can also be beneficial in terms of inhaling particles, but the primary benefit is into hand-to-mouth transmission. Also, when using it as an inhalation prevention, the fit is incredibly important, and the N95 mask is a bit of a bugger to fit properly, and the surgical mask obviously can allow air to seep in around the corners. So I think that is a personal decision. I'm going to show you the unboxing of N95 masks that I ordered prior to reading this article. The one I got does have the respirator valve in it, which I think is useful if you wear glasses. My problem with the N95 has always been, when I'm using it in the shop, has always been that my glasses fog up. So I used these in the yard yesterday on a project, and I'll tell you about that when I do this unboxing. So I'll put the link to this scientific study, and I hope you find this information useful. I'll also put the links to some face masks down below on eBay, which is where I got my N95s. So moral of the story may be don't go out and spend outrageous amount of monies on the N95 mask for coronavirus protection. Okay, here comes the unboxing. All right, as promised, here is the unboxing. Came in this box here of the Echo Solutions N95 particulate respirator. These come 10 to a package. I'll give you the details here if you're interested. Link is below. It says easy breathing and speaking, snug fit, adjustable nose piece, soft smooth lining. Okay, so let me show you these. They come 10 in this package. As I mentioned, I did use one yesterday in the yard for some sanding that I was doing. They are not individually packaged. They are all grouped together inside the plastic. Here is what they look like. So there is the nose bridge on the top. There are double bands for around the back of your head. Not an ear loop. Not an ear loop respirator. NIOSH N95, made in China. And there is the respirator. So, and there is the nose device that you bend over your nose to get a snug fit. To be useful for to curtail the inhalation of virus, really has to be a snug fit. And I found it a little bit difficult to get a snug fit. You really have to kind of mess around with the nose piece, which bends. I found that this piece loosens. Of course, I was taking it off and putting it back on, and the nose piece did loosen and become not very useful. I wasn't getting a real snug fit around the nose about the 5th time I did that. Of course, for infection control, you would dispose of it. You know, it's only useful as a single use, and then carefully disposed, wash your hands, and then you know, get the next one the next time you use one. I did find that when I had a snug fit on this, nice snug fit all the way around, that the exhalation valve did help with the fogging of my eyeglasses. So I think that these are superior in my mind to the ones without the valve. If you have that problem with fogging, you know, fogging up your glasses when you exhale. Inhaling has a little bit of a strange odor to it. I don't know if it's a something in the manufacturer or if it's some kind of disinfectant, but it had kind of a sweet or almost lemony smell to it when you breathe in through it. So there it is. You know, certainly useful for work around the house. Recommended by the CDC, but definitely, according to the article I just read, no more useful than a regular surgical face mask. And those are much, much cheaper. These were, I think, a little over $1 a piece. No, $2 a piece when I purchased them. So there is some price gouging possibly going on with these. But I think that's a superior N-95 mask. It does have kind of a softer feel on the inside, and the nose bridge is definitely appreciated. But these are uncomfortable to wear. I mean, I do not like wearing them, and if I was looking for flu control, I think I might prefer the surgical mask. But there is my review, and hope you found this useful, and stay safe out there, guys. I'm not a doctor or scientist, and just providing this information for the community's good. All right, you make your own decisions. And if you have any other thoughts, please leave them down below. We do have, where I live, there are several cases and quite a few people in confinement, and who knows where it goes from here. But if you are in a place or a country where you need these, I think you'd be wise to stock up on one of the 2 kinds of masks. All right, guys, I'll talk to you later. Thank you.